Gene Speech Language Therapy. Today I'm going to talk about ALS. One of our patients was diagnosed with ALS, and I just learned that out today. Today isn't going to be scripted as normal because I just want to talk about ALS. So ALS is amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. In my personal opinion, it is one of the worst possible things that anyone could experience. To get the diagnosis is heartbreaking. It's something that turns people's lives totally upside down. Your hopes for the future are usually crushed, and depending on what type you could have usually just a few years left to live. So with ALS, there are two different kinds, but in both, eventually you will have difficulty walking, you'll have difficulty with your limbs, and then eventually you'll have difficulty speaking and swallowing. Because it's progressive and there's no cure, you eventually lose the ability to do all of those things. So most people at the end with ALS will not be able to walk. They won't be able to use their arms to be able to feed themselves or dress themselves or brush their teeth. You aren't able to swallow, so you're no longer eating and drinking. And you won't be able to talk a lot of the time. And so you rely on alternative means of communication. With ALS, many people die from just complications from their body shutting down, for instance, suffocating. I don't know what it's like to have ALS, but I've seen 3 people now who have had it. One of my clients passed away from it a few months ago, and it's traumatizing to be a part of. I can't even imagine what it's like for family and friends or for people who have ALS. It's scary to think about losing your ability to communicate. If you think about it, it is one of the things that makes us human. If you had to choose any one thing to take away, you wouldn't want to take away your ability to communicate. Communication is key for our well-being. It allows you to not only have your needs met, but also express your feelings and your desires for the future. These can be little things like, my right arm is really painful, I need something for it. Or it can be bigger, like, this is what I want you to do with my money, things like that. And personal connections, just being able to communicate with people so that you can feel like you're participating. So, with that said, I want my client to know, and I want everyone else who's involved with ALS to know that there is help for you. Speech therapy can help you with your swallow. Your needs are always going to be changing in terms of what you're able to do, and if you're working with a speech therapist, we can help you to adapt, learn new strategies, figure out what's working for you so that you're able to eat and drink for a longer amount of time and increase the pleasure of eating. Your communication is going to change. We can work on your voice and your speech to try and keep it a little bit stronger for a little bit longer. We can educate your family in how to communicate with you so that you're able to have a good interaction with them. If you do end up not being able to communicate in the end, there are ways of expressing yourself with alternative and augmentative communication. Speech therapists are experts in this field. You don't have to get a big, cool device, although you can, and they have devices that are called eye gaze devices, where all you have to do is blink on where you want to go and what you want it to say for you. And there's low-tech devices where you have a board and it's a blinking system. There's all kinds of options that you have. I don't really know what to say for people who get this diagnosis. I really wish that there was a cure and better treatments for it. If you know someone who has ALS, go visit them and make sure they stay involved and that you're letting them know that you're there for them. Check back next week for our next video. Thank you. Bye-bye.